So the next one is elastin. We have discussed collagen, now elastin. Elastin is a protein which is flexible type of protein which is rich in non-hydroxy forms of glycine, proline and lysine. Non-hydroxy form of proline amino acid, glycine amino acid and lysine amino acid. They have a tropoelastin with fibrillin scaffolding. The cross-linking it occurs like in collagen extracellularly, and antitrypsin it inhibit elastase enzyme which dissolve these protein and decrease elastin protein in the body, and antitrypsin inhibit this elastin eating enzyme to preserve the elastin in the tissues. And elastin cross-linking is not affected or normal with aging. During aging we have increased level of collagen cross-linking but not elastin. So the abnormality related to elastin is Marfan syndrome. Marfan syndrome is autosomal dominant with variable expression. It is the abnormality at the chromosome number 15 of the fibrillin PN fibrillin 1 gene mutation which can causes fibrillin 1 mutation. Because of this mutation we see no shielding or no sheath or no scaffolding around the elastin protein, around elastin, which can cause no sheath and also no transforming growth factor sequestration like effect. Sorry. So what are the abnormalities which happen in the Marfan syndrome? In the Marfan syndrome we have the skeletal abnormality, we have the heart abnormality, we have the eye abnormality, and eyes are up and out. Eyes are there is a subluxation of the lens which are up and out, and also in the heart we have mitral valve prolapse, valve abnormality, because valve is elastic tissue which can change its form and reverse to its original side. We can also see cystic medial degeneration of aorta. Aorta can also expand or reverse to its side. Then we have aortic, the most common cause of death is aortic aneurysm, which is most common cause of death, aneurysm of the aorta. Then also we have the spontaneous pneumothorax, the lung tissue abnormality, or there is a bursting of the lung tissue which can causes a trap of the air into the thoracic cavity. Also we have aortic root aneurysm, aortic root dilatation, or aortic root aneurysm. So these all are mitral valve and aorta related problem. In the skeletal, we have chest abnormalities, chest, pigeon like chest, excavatum type. Then we have the tall limbs, and then we have the finger abnormality, which is known as acranodactyly, long fingers, thin fingers, and then hypermobile joint abnormalities. In Marfan syndrome, we have a comparison between Marfan syndrome and homocystinuria. Homocystinuria. Marfan disease or Marfan syndrome versus homocystinuria. The first one is genetics. Marfan syndrome is autosomal dominant with variable expression. Homocystinuria is autosomal recessive. Lens problem. Marfan syndrome is up and out. Homocystinuria lens subluxation is down and inward. Also, Marfan syndrome, we have aortic problem, that is aortic root dilatation, cystic medial degeneration of aorta, aortic aneurysm, and these all are aortic related. But in the homocystinuria, we have seen aortic root thrombosis, thrombus formation, and also there is intellectual disability in homocystinuria. So these are important aspects of comparison between homocystinuria and Marfan syndrome. We have closed the discussion on elastin and Marfan syndrome, which is very much high yielded, very much important.